Hi, I'm Dr. Beth Molleson.
And I'm Dr. Alyssa Watson.
Thanks for joining us here in the Veterinary Breakroom, where we have short conversations about relevant topics in vet med. And today we're going to dive into something that's been popping up in some veterinary headlines lately, and that is monoclonal antibodies. I know I saw a recent article in Global Newswire titled Monoclonal Antibodies in Veterinary Health Market Size to Grow at 17.1% CAGR by 2034. So basically, pretty extreme growth in that drug class. So we just want to chat about what does that mean? What is the current state of monoclonal antibodies and where are we headed? So Alyssa, I think my first question for you is going to be, do you remember when and what the first veterinary monoclonal antibody was?
Yeah. So definitely remember that it was Loki VetMab. I do remember, obviously that was like a huge time in new therapeutics for atopic dermatitis. And I was very, at that time in my career, I was actually still kind of considering a dermatology residency. So I was super excited about it. That was the first one that I learned kind of all about monoclonal antibodies, how they work, how they're targeted. Obviously they're proteins, they're lab made proteins, designed to target a specific molecule. And so, we use this to modulate the immune system. And in veterinary medicine, as you were saying, and dermatology is one place that we've really leveraged these medications. Also, pain management is another one, but they are frequently being studied and used for all sorts of conditions. So, especially in human medicine too. So things like cancer, migraine prevention in human medicine. And so, yeah, I was so excited to have this conversation because that headline was striking to me. I mean, 17.1% growth. If you look at, some graphs or curves of not only the number of these products coming out, but, how much practitioners are using them, it is like an exponential curve. And so I think that brings up a lot of questions about how, not only how we're utilizing these, but how are we as practitioners staying current on all the new research. So that's one thing that, I definitely wanted to talk about today. So yeah, I don't know the exact year that Loki Vet Map came out. Do you happen to know that?
I believe it was 2016. That's at least what I read this morning, and it fits my clinical memory of I graduated in 2011. So I certainly remember practicing a few years without it. We,
Mhm.
of course, had oclacitinib, I think starting in 2011. Don't quote me on that, but I remember practicing with that. And then Cytopoint being sort of another huge thing to come onto the veterinary market and really did change the way we have treated patients. And then, of course, since then, we've had, like you said, um, monoclonal antibodies in the pain realm, Librela and Silencio. We now have Gilvetmab, Panaquel. So we are starting to expand, maybe not quite as quickly as the human side of things, but obviously, as the headline says, the growth is picking up. I believe I read the statistic I read is there's over 100 in veterinary medicine, in human medicine. So you can see that this is what we're dealing with right now really is or could be the tip of the iceberg. And that's why we see that growth rate to be projected so much. Right now, it's a $1.45 billion industry. And by 2034, it's projected to be a $6 billion industry. So when we talk about the growth rate, those are the staggering numbers we're talking about. Um,
Yeah, those numbers are staggering. When we start talking about things in the billions of dollar range, it's difficult for me to wrap my head around, that much money and what that means for the industry. I think um, you know, as these things become more available, I'm interested into whether or not we're going to see this, the prices of some of these come down, or if we're going to see the opposite. We would expect that as things become, in the market more and there's more competition and more drugs are developed, that the cost actually comes down. But I actually read something a little bit the opposite, especially specifically about monoclonal antibodies right now in human medicine, where a lot of the new research is going to target oncology therapies, and more chronic diseases. And those therapies tend to be about this is in human medicine, not in veterinary medicine, but the annual price of monoclonal antibody therapies for those types of diseases tend to be about $100,000 higher, for oncology and hematology than other disease states. So that was a little bit crazy. And I'm not sure that that's a trend that veterinary medicine can follow. I'm just
Right.
not sure that the market forces will bear that. I don't know. What do you think that this will do to like the overall cost of care coming up?
Yeah, I was going to say it sort of begs the question too. One of my first thoughts is like, what does that do to insurance? I think we're reaching a place in veterinary medicine where insurance adoption is rising. Part of that is due to, of course, some of these staggering vet bills that we are all too familiar with. And yeah, a lot of these monoclonal antibodies are not one-time injections. They are things used to treat chronic disease. So once a patient is getting a monoclonal antibody for their OA once a month, that can suddenly be a huge shift and increase in the cost of care over their lifetime. And so, of course, I see that driving insurance premiums up. Like you said, you would love to think that as manufacturing becomes more available, maybe the prices would go down. But as we know, that's not always the case in the pharmaceutical industry. And, they have to drive innovation from somewhere, and sort of where that cost coming from and how sustainable is it going to be for the veterinary profession. You'd like to think there's someone out there making sure that the advancements are done at a rate that people are going to be able to afford it, and adoption is going to be um, promising and good for all of our patients, that all of our patients can benefit from it. But yeah, cost is certainly a huge thing, as we all know, that we have to think a lot about in veterinary medicine, and it makes you wonder what it looks like in the future. But I think it also, my second thought was sort of, is this really going to change the standard of care? I don't know about you, Alyssa, but I feel like it really has, especially, again, using canine OA as an example, where it used to be that if we had a patient that wasn't a good candidate for NSAIDs or wasn't handling their NSAIDs well, we didn't have a lot of options. But now it's, standard of care would be to explore some of these other explore monoclonal antibodies, see if the patient can benefit from them. And so another concern that pops up is, how do we keep up with all of this? How do we make sure we're staying on top of what's available, how to use it, what the side effects are? I think there's just a lot that comes with it for us as everyday veterinarians to try to stay informed and use these as judiciously as possible in our patients.
Yeah, I agree 100%. When you have such an accelerated rate of innovation and new products, it really does make it difficult to keep up with practitioner education. And so then you have to, you have to budget your time, and you also have to really trust your sources of where you're getting information from. And so certainly we know that there's going to be, educational webinars and CE events, and there's going to be trusted experts in the field that we can turn to in order to try to determine, when should we be using these products in our patients. I'm always kind of interested to see if there's a big difference between how general practitioners use these types of therapies versus specialists, just because we have, we see a very different pool of patients, and so at these tertiary facilities, I think it could be twofold. They could either be using these types of therapies more often because they're kind of the last ditch. We've tried everything else with their general practitioner and now they're going to see a specialist. Or potentially the other way, if clients have the money and the resources to go see a specialist, they might have just a larger arsenal. And so they're reserving some of these monoclonal antibodies to last. I've seen both things, honestly. I don't know about you.
Yeah, especially when we start to talk about cost, is this something that we're reaching for when maybe there are other treatments available? Certainly, as we start getting into things like oncology, where maybe monoclonal antibody is going to be the only thing available that's going to give our patients a chance, I think that certainly shapes adoption as well. Maybe we're a little more hesitant to give up our NSAIDs or whatever the case might be to make a switch. But if we're talking about a disease that this is the first and only treatment, I think then maybe it's a lot more likely to find its way into becoming common use. But yeah, I don't know. I think there's a lot to look forward to. I think a lot of us know humans who've have been impacted or have benefited from monoclonal antibodies and biologics. And, I think it's pretty cool to know that veterinary patients are not being left behind. And there are pharmaceutical companies that are really heavily focused and invested on this, and that it really is going to impact us in the coming years.
Yeah, that's a good point too, because these therapies are so targeted. It's not like we can just pull over from human medicine, a monoclonal antibody for a person, because these are almost always exclusively species specific, almost always. And so even something like the monoclonal antibody for osteoarthritis in dogs, it took years and years before we got the one for cats, because of the differences there. So yeah, I just out of curiosity, when we're looking into this, do you know what the first human monoclonal antibody was used, what it was made for? It was,
No,
it came
tell
out,
us.
it was approved back in 1986. And it was used to target T cells to suppress the immune response that would cause organ rejection for transplants, for people who were undergoing transplants. And so I thought that was really cool. Kind of a neat fun
Yes, and
fact.
I was to say it goes back further than I would have guessed, honestly.
Yep.
Back to the 80s. Well, yes, lots of food for thought here. Wanted to bring it to everyone's attention. Like I said, I know we're all very busy in the clinic. We don't catch all these headlines, but Alyssa, I think that brings us to win of the week. Any big wins for you this week?
Well, I think definitely one of my big wins. The last time we met, we talked about how we were having an all-company retreat coming up, and so a lot of our team members from all over the country that we don't normally get to see the bottom half of all got together, and that was wonderful. Beth, you were there, but also our producer Alexis, and so many other people on our content team, and then on our Instinct team that works on so many other wonderful projects and plums and standards. And it was just great to get everybody all together and see everybody.
Well, Alyssa, that was going to be my win as well. It's a big event for us who work from home a lot of the time to see people in person. And yeah, we got to go across the country to New Mexico, which I had never been to before either. So that's really my big one, is getting to explore that area of the country, which was just beautiful. We had great weather, great company, and
you and I got to go
most of us. Oh yeah, we
got to go horseback riding.
Oh, fulfilling our horse girl dreams. So anyway, well, Alyssa, great to chat with you, and to our audience, thanks so much for tuning in. We will catch you next time.
Thank you.
Thank you for joining us in the Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@instinct.vet. Veterinary Breakroom is an Instinct Science production, produced by Alexis Ussery and co-hosted by Alyssa Watson, Beth Molleson, and Katie Berlin.